My name is Kibuule Michael from University School of Public Health. Risk factors for this Ebola outbreak include behavioral, cultural, institutional, physical contact, and poor hygiene practices. Preparedness, on the other hand, is a combination of knowledge with other capacities developed by individuals, communities, governments, professional bodies, for response and recovery organizations to ensure that preparedness happens, for Ebola most especially. Preparedness level of healthcare system determine the magnitude of impact of the outbreak when it occurs. This study set out objectives to assess the preparedness of healthcare systems for Ebola outbreak response in Kasese and Rub district. This border Congo. Specifically, we looked at establishment of preparedness level, the district's healthcare infrastructure, and to respond to the EVD outbreak. To determine the logistical preparedness of healthcare system to manage a suspected incident of Ebola in these districts. To establish the healthcare workers' level of knowledge on preparedness for containment of Ebola, disease outbreak in Kasese and Rub. And the last one was to determine the overall level of preparedness for the Ebola virus disease outbreak in the response in Kasese and Rub districts. We looked at the doctors as the population, the staff population, doctors, medical clinical officers, nurses, laboratory technicians, midwives, and nursing assistants, and the people who were supposed to respond to our questions. This was a cross-section study with mixed methods of qualitative and quantitative. We looked at also all the hospitals in the districts, and also the health center force in both districts were also purposefully selected. 50% of the health center cities were also randomly selected. We used a ballot paper. Health workers were selected randomly, and 189 out from 22 health facilities were also interviewed using structured questionnaire. Then the level of preparedness, level of infrastructure preparedness was measured at a 14-point scale, and logistic preparedness was also measured at a 14-point scale. Then all the essays scored 0, and also the nose scored 0 with a cut-off point of 50th percentile. Results: overall, 55% of the health facilities were categorized as not prepared in terms of infrastructure and did not have adequate logistic capacity. And then 54% of health workers were not knowledgeable about Ebola virus disease. All the health workers were 6 times less likely to be knowledgeable, at of course a confidence interval of about 0.1 to 0.91. Majority of the facilities did not have case definition books, rapid response teams, or committees, barrier teams, and also did not conduct simulation drills to ensure that they develop the skills. All facilities did not have viral hemorrhagic fever, incident management centers, isolation units, and guidelines for burial. That is safe big fan burial, 1 meter distance, and between the health worker and the patient for triaging. Infrastructure, logistics, and knowledge levels of health workers. All the above parameters in both districts were suboptimally prepared for Ebola outbreak response in case this occurred. Preparedness for Ebola disease outbreak in rural districts is essential to help reduce impact of disease in communities. Then recommendations: national stakeholders and district level health should organize a multi-sectoral simulation exercise to appreciate the need to be on the alert at all times. Critical logistics like personal protective equipment, triple packaging carriers for highly pathogen specimens, and clear transportation mechanisms should be availed at all times. Then Ebola biology, etiology, epidemiology, and pathogenesis should be designed for both in-service and out-of-school training curricula. I want to acknowledge this as the people who funded me, the International Development Research Center, through One Health for East Africa, East and Central Africa, the entire One Health committee or team in Uganda, my lecturers at the School of Public Health, the supervisor, and then the professors who were with me in the research. And then the health workers whom I conducted the research or whom I asked questions. I also acknowledge them. I don't submit.